Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Back in 2020, I reported on a published paper in the Annals of Rheumatology showing that the regular use of glucosamine supplements was associated with a significantly reduced risk of dying from cancer, cardiovascular disease, respiratory diseases, diseases of the intestinal tract, as well as reducing the risk of all-cause mortality by 15% compared to non-users of glucosamine supplements. So in other words, back in 2020, there was evidence that people who were using glucosamine supplements, usually for joint care, were also getting a secondary benefit where they're seeing a reduction in risk of cancer, cardiovascular disease, decreased respiratory illnesses, intestinal tract problems, and a decreased overall mortality rate. So this data was derived from the approximately 500,000 individuals who are being followed in the UK Biobank study. Now, in November of 2022, an update of the UK Biobank study was published in the Frontiers of Nutrition, which focused on glucosamine's protective role or potential protective role against cancer. So this data is important because the UK Biobank study is one of the largest population studies in the world whose stated aim is to improve the prevention, diagnosis, and treatment of various diseases, as well as promote health across society. Now, the study originally included over 500,000 participants, 38 to 73 years of age across the UK, who entered the study between the years 2006 and 2010 and were followed until March 2021. Now, none of the participants had cancer at the beginning of the study. So they showed that after controlling for other cancer risk factors, individuals who routinely took glucosamine supplements showed a significant decrease in overall cancer risk by 5%, a 32% lower risk of developing of kidney cancer mortality, a 16% lower risk of lung cancer mortality, and a 24% lower risk of rectal cancer mortality. As the researchers pointed out, in addition to supporting joint cartilage in the prevention and management of arthritic conditions, glucosamine has also shown important anti-cancer properties in experimental and animal studies. So glucosamine is shown to inhibit the proliferation of many types of human cancer cells, and it induces programmed cell death, or a type of cell suicide, for many types of human cancers. Glucosamine is also shown to reverse tumor drug resistance and inhibit the ability of tumors to form new blood vessels to feed themselves. This is known as anti-tumorigenesis. It also shows the ability to block the capability of cancer cells to invade neighboring tissues by inhibiting their ability to produce destructive enzymes known as the matrix metalloproteinases. As the researchers point out, several epidemiological studies have indicated that glucosamine is connected to reduced cancer mortality in the United States and in the United Kingdom. In some studies, a reduction in overall cancer risk of 15% has been documented. It may interest you to know that in most European countries, glucosamine is only available as a prescription drug. But in Australia, the United States, and Canada, glucosamine is available as an over-the-counter supplement. About 20% of Australian adults use glucosamine supplements, whereas about 2% of U.S. adults use glucosamine supplements. And in Canada, glucosamine is estimated to be used by about 5 to 7% of the adult population. Now, most people use glucosamine supplements for arthritic conditions, but the emerging evidence suggests that it may also represent an additional protective step you can implement to prevent arthritic changes, as well as to help reduce overall cancer risk. My preference is to take a glucosamine supplement that also contains 3 natural anti-inflammatory agents, namely quercetin, bromelain, and MSM, which help to make it a faster acting product for your joints. And these natural anti-inflammatory agents, quercetin, bromelain, and MSM, also show their own unique anti-cancer properties in a variety of studies. So I've included those study references below. My advice remains that most people should consider taking a supplement of this type around age 40, which is the time in your life when your body begins to make less glucosamine on its own. So I've included the references for all of this information in the text below. Thanks for watching, and I'll see you next time.